Hello, everybody. Welcome back to day 2 of our Ontario Network of CAPC CPNP projects virtual online conference. My name is Sydney Bell. I am the program lead for the network, and I'm delighted to be here with you all. And I'm really happy to introduce Mary Motz, who is going to speak to us about supporting secure attachment and positive parent-child relationships. And I'd just like to say a couple words about Mary. She is a clinical psychologist at Mothercraft's Breaking the Cycle. And it's a program in Toronto and has adjunct faculty status at York University. Since 1995, she has worked with pregnant people, mothers, and their infants and young children who are at risk for maladaptive outcomes related to substance use, mental health difficulties, interpersonal violence and trauma, marginalization by society, systemic violence, and poverty. We really are excited and value all the work that you've done and are looking forward to learning from you, Mary. Welcome.
Thanks so much, Sydney. I'm going to work on sharing my screen here. I had this all figured out on the break, so hopefully it's going to go smoothly. Oh, and I don't think it did. Hang on. Is that the right screen, Sydney?
I'm seeing your desktop.
Oh, yeah. Okay. Let me do that one more time.
And are we okay with, having people on screen with you, Mary?
Oh, I'm not going to see anybody because I've got
okay.
I've got notes up in front of me and my slides. So yeah, so this is good for me. Is that good? We're good now?
Absolutely. Maybe what I'll do is I think I can spotlight you there. Oh. I don't know if that's a good thing, but hopefully. Off you go. I'll worry about the technical stuff.
You're amazing. Thanks so much, Sydney, for inviting me to speak with you today. Everyone, as you know, my name's Mary. I use she, her pronouns, and I'm a 5th-generation settler from Central Europe. I'm a mom of 2 amazing adult children, but most relevant for this presentation, and as Sydney mentioned, I'm the clinical psychologist from the Mothercraft Breaking the Cycle program. And I know we've had a formal land acknowledgement. I just wanted to express my gratitude for the traditional inhabitants and ethical caretakers of the land I live on and work on here in Treaty 13 territory. So I'm not going to spend a lot of time talking about breaking the cycle. I just want to give you a little bit of context for the work that I do and the lens from which I apply an attachment-based framework. Breaking the Cycle is a CAPC funded program. Our population is infants and young children who are at risk for poor mental health and developmental outcomes because of maternal substance use and related factors. We also have a CPNP funded program, which is our Breaking the Cycle pregnancy outreach program. And like all CAPC and CPNP programs, we recognize that in order to support the well-being and resilience of young children, that we need to take a holistic approach by promoting the health of pregnant people and of parents, for us, that's specifically mothers, along with their young children, and recognize that the motivator for our families in many cases and that mechanism of change is in supporting secure attachment and building positive parent-child relationships. So this slide represents many of the factors that lead to vulnerability in the families that we see, and I'm sure in the families that you see as well. And it also helps us to understand why secure attachment and positive parent-child relationships may not be as intuitive for our families, given their histories and their life circumstances. That being said, all the parents I've ever met at work and in my real life really want what's best for their babies and for their children to have the best capacity for their lives. And maybe I'll just put in here a note on language that in order to include all the different ages of children and respect different kinds of families, I tend to use terms interchangeably like infant, child, and kid when I'm talking about young people, as well as parent or caregiver when I'm talking about their related adults. So inherent to the Breaking the Cycle model, really, or any holistic model of working with families, with babies is that babies exist in the context of relationships, and they depend on their caregivers for all of their survival needs. Like my work wife, Gina, says, babies don't walk into our programs on their own. They need their caregivers to come and bring them to program and become a part of their lives in every way. And the relationship between the baby and the caregiver is a mutually enforcing system, so that ultimately it promotes the physical and emotional development of the baby. And also, if we want to talk about constructs like resilience, babies aren't born resilient. They develop resilience through their family environment and within their relationships and their families. So what is attachment then, and where does it fit into supporting the infants and young children that we see? The foremothers and forefathers of attachment described it as a deep and enduring emotional bond that connects one person to another across time and space. It's been described as a lasting psychological connectedness between human beings. Attachment theory explains how the parent-child relationship emerges and influences the subsequent development of children and of their relationship capacity. And that attachment seems to be universal across cultures. And by saying that, I don't mean that the exact behaviors and mechanisms of attachment are exactly the same between cultures, but that emotional bond and connectedness between a parent and a child, and the need for the child to use their parents to secure their safety and security has been described across cultures. So then a question that's really common is, what is the difference between attachment and bonding? Because a lot of times they're used interchangeably. So bonding is really all about the parent. It's that surge or feeling of love and tenderness for the baby that can develop either during the pregnancy, following the birth, or even a few months later. So bonding is not a dyadic construct, and it doesn't relate to the baby's needs or feelings. Attachment is about both a parent and a baby. It's about how they build that relationship over time and how it ultimately helps the baby to feel safe and loved and secure. And it also teaches the baby how to be in relationship. So ultimately, in the context of the attachment relationship, a baby learns what to expect from others in relationships, but also how they deserve to be treated in relationships. And luckily, all babies come primed with really excellent survival strategies, or strategies to promote their survival by keeping the parents close to them. And they show us these strategies in their day-to-day interactions. So they show us by smiling or clinging or crying when they want us to meet their needs, and that draws us closer. But it's really the way that the caregiver responds to the baby's needs, which dictate whether the child's attachment system becomes activated. Babies use their caregivers as a secure base to understand and to explore their world. But when they become frightened or sick or hurt or dysregulated, they use these proximity-seeking behaviors to draw the parent close to them, so that they have the opportunity to use the parent as a safe haven to manage and regulate those emotional needs. And then it's the baby's experience of their parents' responsiveness at these times that provides the blueprint for babies to know what to expect and what they deserve in relationships. So the attachment system is always present, but we talk about it becoming activated in the situations where babies need it most. So those are those times when they're scared or dysregulated or distressed. And so they demonstrate this activation in a variety of ways. They can demonstrate it by following their caregivers, so either physically or even with their eyes, if they're small babies, to be able to keep their caregiver in proximity, especially in new situations. We see this. Kids will want to make sure they know where their parent is. They can cry when a parent leaves to signal that they want the parent to come back. They can become anxious or upset when a parent is not present. They can get super excited when a parent returns as almost like a reward for coming back and being available. They can get clingy when they worry that a parent might leave them, or they can become upset or fearful in the presence of strangers. And those are all indications that the attachment system has become activated. So what does this look like? What I'd like to do is show a short video. This is the still face experiment. It was developed in the mid-70s to demonstrate an infant's capacity for emotional attunement to the parent. Many people have probably seen this before, but it's a really great example of what happens when the activated attachment system is ignored.
Babies this young are extremely responsive to the emotions and the reactivity and the social interaction that they get from the world around them. This is something that we started studying 30, 40 years ago, when people didn't think that infants could engage in social interaction. In the still face experiment, what the mother did was she sits down and she's playing with her baby, who's about a year of age.
I'm like a girl. Oh.
And she gives a greeting to the baby gives a greeting back to her.
Yeah.
This baby starts pointing at different places in the world, and the mother's trying to engage her and play with her. They're working to coordinate their emotions and their intentions, what they want to do in the world. And that's really what the baby is used to. And then we ask the mother to not respond to the baby. The baby very quickly picks up on this, and then she uses all of her abilities to try and get the mother back. She smiles at the mother. She points because she's used to the mother looking where she points. The baby puts both hands up in front of her and says, "What's happening here?" She makes that screechy sound at the mother, like, "Come on, why aren't we doing this?" Even in this 2 minutes, when they don't get the normal reaction, they react with negative emotions, they turn away, they feel the stress of it. They actually may lose control of their posture because of the stress that they're experiencing.
Okay. I'm here. And what are you doing? Oh, yes. Oh, what a big girl.
It's a little like the good, the bad, and the ugly. The good is that normal stuff that goes on, that we all do with our kids. The bad is when something bad happens, but the infant can overcome it. After all, when you stop the still face, the mother and the baby start to play again. The ugly is when you don't give the child any chance to get back to the good. There's no reparation, and they're stuck in that really ugly situation.
So the good, the bad, and the ugly that Dr. Tronick refers to is the way in which babies develop expectations in relationships. Oh, there we go. This is one of my favorite models for helping parents to understand the importance of attachment. Many of you probably know about the circle of security. It was developed as a clinical intervention. But here at Breaking the Cycle, we find it's a really useful roadmap to demonstrate the process of attachment. I don't receive any endorsements from Circle of Security. I wish I did, but I just wanted to let you know that they have a lot of free resources on their website, which can be really helpful to support parents, even if you're not using the intervention. Really briefly, as the child moves around that circle, they use their parents to support them to explore and learn, but also to be there to provide protection and comfort when the child becomes dysregulated or overwhelmed. And then those hands at the left part of the circle are the parent, and they represent the parent as the secure base and the safe haven that the child uses to navigate their world. So the next slide I'm going to show is a short video that does a really great job of explaining how this attachment parenting model works.
Parents, we all wonder if we're getting it right. We want to know we're meeting our children's needs, helping them grow, and giving them all that we can. We try to combine our own experience of being parented with the advice of others and our own instincts and beliefs about what is best. And still, we so often worry that we're not succeeding. In a world that is always offering the next best parenting solution, the circle of security is based on decades of attachment research. Unlike many behavioral perspectives, it offers relationship tools to provide a new way of understanding your children's needs, creating lasting security for them and more satisfaction for you. The circle graphic has been created to help you know what to look for, so you can read your children's behavior to guide you in meeting their needs. It's really not complicated. People of all ages have attachment needs. These needs can be divided in 3 ways. Let's look at this child. First, he needs to know the freedom and confidence to go out and explore his world. Second, he needs to feel assured that whenever he's ready, he can come back for comfort and protection. Third, he needs his caregiver to be in charge in a kind way. 3 basic needs that can be thought of as going out on the circle, coming in on the circle, and hands on the circle. Let's have a look in more detail. Feeling safe and supported, our children want to discover their world. When going out, they need to know that their exploration is encouraged, that we're right there watching over them, delighting in them, offering help when needed, and ready to enjoy their new adventures with them. And when they're coming in, they need us to refill their emotional cup. This means organizing their emotions and letting them know we are delighted to welcome them back, protect, comfort, and understand them. The key for us as parents is to remain strong and kind while knowing when to encourage their going out into the world and how to be available to welcome them back to us. It's crucial that we learn to identify our children's needs like this, because misreading them, or worse, missing them altogether, can cause pain and frustration. We all know how uncomfortable it can be to be held too close when we want to be out exploring, or kept at a distance when we need emotional support, or simply to be without someone who is bigger, stronger, wiser and kind, who we can trust to understand what we need when we're feeling lost, confused, or out of control. When a child misbehaves, the cause is often rooted in how safe and secure they're feeling. So it's not surprising that they behave well when a parent learns to tune into their child's needs on the circle in this way. And because our needs on the circle never disappear, learning to read cues can help you better understand and meet the needs of people of all ages, including your own. So that's all there is to it. Just know that at any given moment, your child is somewhere on the circle asking you to meet a need. Support my going out. Welcome my coming in. Be the hands that keep me safe by staying in charge and committed to helping me feel connected. And please remember this, there's no such thing as perfect parenting. At Circle of Security, we've come to realize that good enough is, well, good enough. All of us are going to miss needs on the circle time and again. Welcome to the club. But if we meet our children's needs enough of the time, the results will be happier, healthier, more secure children, and parents too.
One of the applications I like best about the Circle of Security roadmap is that it not only can be applied to parenting of children of all ages, but also to other relationships that we have along the lifespan, once we can recognize our needs. So the way that the child uses their attachment system can look different based on their experiences of being in relationship with their parents. And as we've seen in the videos, it's the caregiver's response, and particularly their repeated responses, that ultimately shape the child's understanding of what they can expect in the context of this relationship. So when children are responded to by that good enough parent in a way that's consistent and sensitive most of the time, they develop what we call an attachment relationship that is secure. And that's when the child or the infant feels confident that they can rely on their parent to meet their emotional needs for proximity, for regulation, and for protection. There are times when a caregiver is either typically unpredictable in the way they respond to the infant. So the caregiver may also react in ways that are insensitive, like laughing at the infant or child when they get hurt. Or if a caregiver is uncomfortable with the child's exploration or that going out piece of the circle, when that's not something that makes the caregiver comfortable. The infant develops feelings of anxiety about separating from their parent, and they may not feel reassured when they come back to their parent. So that's what has been referred to as an insecure ambivalent style of attachment. In contrast, when we talk about an insecure avoidant attachment, this style is when the caregiver is consistently uncomfortable or unresponsive to the child's need to have their cup filled. The child coming in for comfort is just not a situation that makes the caregiver comfortable. And so, in these cases, what may happen to the child is that they act like they don't need comfort. So they're like, I got this. I don't need you to comfort me. I'm going to do it myself, because they don't depend on the caregiver to be available for them in that way. And so that's the insecure avoidant attachment style. So sort of the fourth style of attachment that we talk about is when a parent is not able to maintain that balance of bigger, stronger, and wiser with kind, or when their hands are off the circle altogether and they're just unavailable. And in these instances, the behaviors of the caregiver and the reactions of the caregiver actually become the source of fear and distress for the child, as opposed to the source of comfort. And so children in these cases lack an effective strategy to feel safe and secure and to have their needs met. And so this inability to find a solution to their distress has been called fear without solution, and often leads to this disorganized pattern of attachment. And with this pattern, the child doesn't have a strategy to sort of restore those feelings of safety using the person that is supposed to actually be their attachment figure. So maybe what I'm also going to note here is that it is totally possible for children to have the capacity for different types of attachments with different people. So they may have a different attachment style with, each caregiver, or a different style with their childcare provider, or, if they have other people in their lives who are caregivers like grandparents or aunties. So there is that capacity for different styles of attachment. We know from clinical observations and from research that there is a relative amount of stability over time in how we engage in relationships based on the experiences we've had in childhood with our primary attachment figure. So these relationships that are developed in childhood with our caregivers can endure into our adult relationships. It's not a perfect correlation, not a destiny kind of thing. And there is opportunity to change attachment patterns in later relationships or to have, healthier relationships. It's just harder work than having developed this understanding of what a healthy relationship looks like earlier on, and usually requires therapy. There are some, these are some of the more common factors that make it tricky for parents to be sensitive and responsive to their children in the development of secure attachment. So again, want to be super clear that just because one of these factors is present, it doesn't automatically mean that there'll be an impairment in attachment relationship, but having one of these factors can make it more difficult for parents to respond in ways that support a secure attachment. And then we also know that when parents have awareness of their own challenges and are working towards reducing them as barriers to responding to their children, or they're coming to programs like our programs that help them to develop strategies to act in more sensitive and responsive ways, that this can help to promote positive parent-child relationships even when some of these factors are present. One of the most common barriers that we see at breaking the cycle is when a parent has a history of trauma and they may not have had positive relationships with their own caregivers, or have totally lacked a positive adult role model in their own childhood. So they just don't have that blueprint for how to parent positively. There were no hands on the circle for them. Sometimes a barrier to promoting secure attachment is that there are really different temperamental styles between the parent and the child that impact sort of that fit in the relationship. So for an example, it might be a parent who's really outgoing or has a really intense style of interaction, and they're more likely to push the child out to explore their world sort of on that top of the circle. And the child may have a more cautious and reserved temperament. And so this might impact how the child feels about seeking comfort from that caregiver, or how they feel about the availability of that caregiver to comfort them. Definitely adults who struggle with addictions or certain mental health challenges may have difficulty in being physically and emotionally responsive to their child, especially when it's active addictions or untreated mental health. So again, they have challenges with being those hands on the circle for their children. Or parents who are isolated or don't have anyone to fill their own emotional cup. They might not always have the internal resources to be consistent or sensitive in responding to their child. So I wanted to take some time to focus on strategies that we can use to help parents develop secure attachment on a daily basis, and to work towards those more positive relationships with their children, because I know really that's what we're doing on a daily basis. The first one I have here refers to that bottom of the circle, where we need to welcome kids back into that safe haven when they're hurt or frightened or upset or dysregulated. And this helps kids to remember that there is someone there to meet their needs in times of distress and to help them feel better. So it's that consistency of allowing them to come back in and to fill their cup for them. Depending on the age of the child, this doesn't mean we actually always have to be physically available. So sometimes with older children, we can comfort them or let them know we're there for them through like a text or a video call, a note in their lunch, or by calling out from the other room, just to help them to remember that we're available. And highlighting again that we absolutely do not need to be 100% perfect in our responsivity. Perfect parenting doesn't exist. It's fake news. And we shouldn't feel guilty or allow the people that come to us for support to just remind them that they don't have to be perfect either. That rupture and repair are actually parts of healthy relationships. And the second strategy I have here is in reference to that going out part of the circle, or the top part, where, we need to respond and notice children and help them and support their exploration, so that they can learn and grow and develop, knowing that we're there as that safe base to support them. Even when children are not directly in our presence, they can use that feeling of security and confidence that we provide them with to explore and learn. One example of this is that sometimes kids really benefit from having a security object or a transitional object or a lovey or whatever we want to call it, that comes to represent that secure base. So even when we're not with them, that they're able to carry us with them. The third strategy refers to the fact that to support children to feel safe and secure, that they actually do need to have a reasonable sense of trust in the world. And so that's totally not to say that we need to ignore the realities of life. Like, we do need to prepare our kids for what their experiences might be, so that we as adults need to think about personal safety and community safety, but it just has to be balanced with not instilling a sense of anxiety or worry that they're always in danger, right? So, maybe when it comes to kids going to childcare or to schools, maybe more specifically, that their overarching tone should be, that this is a safe place you're going to. But if anything were to happen that you're going to feel uncomfortable or unsafe, I'm here, you can come to me and I will help you to make this better, right? Because really, regardless of how much we try to provide that safe space and secure haven for our kids, and no matter how old they are, there's going to be times where things happen to them that are scary and distressing. So another part of the job of a parent is to help children to be able to regulate and to reintegrate those experiences and repair from them. And this will look different based on the age of the child. They, with babies or young children, they may cry or become upset at a reminder of a situation that's been scary. And our job at those times is to hold them and soothe them and regulate their feelings when that distress occurs. And with older kids, they may need something different. They may need to tell us the same story over and over again, or they may need us to read the same book over and over again until they feel like they've mastered or resolved what has happened to them. Kids also need to hold on to joyful feelings and stories and memories as a way to feel safe and secure. And one way to do this is in the context of the family is to develop family routines and family traditions. And these, they don't need to be formal things that require a lot of time or effort, but they can be. It can be things you do with your child every day, or that a parent does with their child every day, like saying an affirmation or saying a prayer or standing in the mirror and doing a power pose together or having a little mantra. I remember when my nieces were babies. My sister has 2 daughters, and she literally had a song for everything, like every routine of the day. And so even when the girls were too little to be able to predict time, they knew what was going to happen because of the song she was singing at that point. Family traditions can be like weekly activities, like always having pizza on the couch on Friday. They can be built around cultural traditions or practices or holidays or family events. But just regardless, it's helping children to understand what to expect as a member of their own family and to feel grounded in their family culture. Children are able to feel more secure when they don't have to worry about where their caregivers are or when their caregivers might be coming back. An example with babies is, maybe you can talk to them or sing them a song from another room when we can't respond immediately. Or with older kids, sometimes you can use strategies to help them know when we're going to be coming back, like timers or clocks if it's for a short period of time. Or over long periods of time, we can use photos or special objects that help kids to know when we're going to come back. I have another sister actually that has a 5-year-old, and This sister is really, she is like the queen of visual calendars. So every month they put a new calendar on the fridge, and the calendar is full of icons. And my niece is she knows what day she goes to after school care. She knows what days she has skating lessons or swimming lessons, when her parents are going away on trips for work, and when they're going to be back, or when her nana's coming to visit. And it's all based on these little pictures on the calendar. And that really helps to regulate her world and to help her to know what's going on. And so the final strategy I'll mention here in promoting secure attachment is that we should try as best as we can, or parents try as best as they can, to react to their children in ways that are predictable and that are positive. And so, when we can be bigger, stronger, wiser, and kind, most of the time, kids come to understand how what healthy relationships look like. And that's what will become normal for them. And they will know to look for those relationships and engage in those types of relationships as they get older. I know many of you are probably here from CPNP programs and are well aware of the factors that can interrupt the capacity for attachment in the prenatal period. But I'll just list a couple of these factors. They can include the mental health of the pregnant person, especially depression. There is a vast literature now on the impact of prenatal depression on outcomes for children in the perinatal period and moving forward for their development and mental health. We also know that trauma, and I know you had a great talk from Jocelyn about this earlier on, but trauma impacts our capacity for relationships, and it's not always just the kind of trauma that sometimes we think about, like in the moment, that experiences of violence and trauma, but it can include the impact of colonialism and genocide, as well as the impacts of systemic violence and community violence. And then the last thing that's really can be a huge impact on prenatal attachment is a lack of prenatal support. So this can be due to the isolation of the pregnant person, not having people around them to support them, but it can also be as a result of under-resourced community services and not having the ability to connect and use community supports. We know from research and from our experience in our community programs that there are a number of prenatal activities that also support those early relationships, including those around health promotion. So, eating well in the pregnancy and abstaining from harmful substances. Nurturance is a really important part of prenatal attachment. So singing to the belly, stroking the belly, talking to the belly, and also that physical preparation for birth. So, getting things ready in the home those items that we think about when we get ready for babies to come. These are things that help prepare the expectant person for parenthood, but also the impending relationship with the baby. But I think mostly, really, we want to help pregnant people to remember that it is never too early to think about attaching to the baby and about supporting parenting relationships. The other part I wanted to mention is in and around the importance of our programs, because I know a lot of us are connected to childcare centers or offer child minding in our programs for families, but that we have families that are engaged in community childcare as well. So promoting attachment in those childcare experiences, because early childhood educators and other caregivers become important attachment figures for infants and young children. So some of those strategies can include making sure that our childminders and early childhood educators are trained in attachment-based frameworks so that they have the basis for understanding children's needs for security, for exploration, and for having their cups filled. We should ensure that there are adequate caregiver-child ratios so that caregivers have more opportunity to be responsive to individual children when that's required, in those times of dysregulation. So using primary caregiver models is also really helpful, where a caregiver is designated to a set number of children so that they sort of develop that special relationship, and the child knows what caregiver that they should go to when they're feeling need for comfort. We need to have adequate supports for transitions in childcare. Those, things like going to meal times or going outside are times when sensitive children tend to become distressed and are more likely to need support and extra attention. So maybe even having extra caregivers available at these times, and especially for sensitive kids who are not good with transition. We should have programming that supports the individual needs of children. So understanding children's unique social, emotional personalities, right? And knowing which kids are going to struggle more in those social relationships, and promoting pro-social behaviors. And having an environment where there are active and responsive interactions between the caregivers and the children, so that it's not just the kids are going over in one space and the caregivers kind of stay over here. Like, there needs to be that interaction between them to support that movement around the circle. And similar to what I mentioned about incorporating traditions into the family environment, I think it's really important to have family involvement in the celebration of cultural traditions in childcare environments, which will help children to feel a sense of security in their selves and in their identity. And then finally, having comprehensive and integrated services like we have at CAPC and CPNP programs, where there are a number of services that meet the needs of families in one space, so that we're thinking about families in a holistic and secure way. So I'm aware of the time, wanted to finish with this little video from 0 to 3, which is an amazing organization that supports the understanding of infants and young children, and gives some really practical suggestions that we can provide parents with how to foster attachment through what they call everyday moments of magic, which I love.
If you're like most parents, you have an image of the kind of person you want your child to grow up to be. Successful, smart, kind, thoughtful, a good friend. The great news is that you play a major role in making this happen. And it's not by using flashcards or following some academic training plan. It turns out, according to a large body of research, that the key is providing something known simply as responsive care. Responsive care. Never heard of it? Most people haven't. So what exactly is responsive care? Responsive care is the process of watching and tuning in to your child's cues and thinking about what his behavior might mean, and then responding in a sensitive way. By doing this, you meet your child's physical needs, but just as important, his emotional needs as well. These parents watch closely to understand what their baby's actions are telling them. Rubbing his eyes and yawning is this baby's way of saying, "Mommy, Daddy, I'm sleepy." And his parents know just what he means and give him just what he needs. While this may seem pretty ordinary, when you respond to your child's unique needs, the effect is quite extraordinary. Why? Because study after study has found that this kind of parenting leads to children building what we call a secure attachment, a warm, trusting relationship with his or her parents. And secure attachments in early childhood lead to a whole host of positive outcomes for children that can last into adulthood. It all starts in a baby's first days of life. Research shows that babies whose parents respond promptly to their cries and provide comfort actually cry less when they become toddlers. Surprising, isn't it? So many people think that comforting a crying baby is spoiling them, but it's not. When parents respond to and comfort their babies, their little ones learn that they can trust their parents. This creates feelings of safety and security. Over time, these children experience less anxiety and distress. They have learned that their parents will understand and respond to their needs. Children who experience responsive care and have strong, positive relationships with their parents also tend to be more independent and develop stronger problem-solving skills, key factors in doing well in school. Research also shows that when parents provide responsive care by taking turns in their interactions with their young children, following their child's lead, expressing positive feelings, and providing age-appropriate toys, books, and other activities, children are more likely to develop strong language, cognitive, and social skills later on. Parents help build their children's self-esteem when they offer support and encouragement to keep on trying when faced with a difficult task. The ability to persist at solving a problem builds children's confidence that they can master the challenges they face. So if responsive care is critical for all of these really positive outcomes, how do you do it? The key? Be a good observer. Tune in to your child's unique way of communicating what he is thinking and feeling. Discover what she likes and dislikes. It's like being a detective. Research shows that when parents take the time to think about what their child's behavior might mean and how they might be feeling, their children are better able to understand the emotions and perspectives of others. Another important feature of responsive care has to do with you, with parents managing their own thoughts and reactions. That means tuning into your own feelings, especially when your child's behavior pushes your buttons. Learning to manage your feelings and reactions is a critical part of responsive parenting. Feelings are not right or wrong. It's what you do with your feelings that can be helpful or not so helpful. When you stay calm and manage your feelings and reactions, it's easier to choose the response that will be most useful for the situation and for your little one. So what does all this mean? You matter. When you provide your young child with responsive care, it's the gift that keeps on giving. The bond you share with your baby becomes a blueprint she will take with her forever, her first and most important model of a loving relationship.
So finally, I'd just like to leave you with some resources that might be helpful if you're looking for more information about attachment and fostering positive parent-child relationships. Many of these I've referenced already in the presentation, but I just wanted to make sure you have them because they're my favorites. I'm so grateful to have had the chance to present to you today. Thanks so much, Sydney, for asking me to be here. I hope it's been an amazing conference and that it continues to be.
Here I come. Hello. Thank you so much, Mary. Really appreciate this wonderful overview of attachment and how we, as working in CAPC and CPNP projects, can support that in the families we work with. We do have time for some questions or comments if anybody has anything they'd like to check in with Mary about before we do our coffee card giveaway. I'm seeing some props and thank you for you, Mary, in the chat. Just highlight that for you. So does anybody have any questions? Feel free to put up your hand or unmute or type it in the chat. Feeling okay with the information? Okay. Wonderful. Well, it'll be interesting to see. In listening to your presentation, Mary, there were a few little quiz questions. And what we're doing, I don't know if I made you aware of this, but we're giving away some coffee cards. So the first person to get the right answer and put it into the chat will, and there's a few more props for you, Mary, in the chat here. Okay, so let me copy and paste. Okay, so the question is, attachment helps the baby learn how to be blank. Attachment helps the baby learn how to be secure is a good answer. There is a specific answer I'm looking for. If we don't have it come forward, I think oh, yeah, good. These are all correct, but they're not quite what I'm looking for. It was something Mary said near the very beginning. Mary sent me a note saying she would say secure. So why don't we go with secure? Who said secure? P. Andrews. P. Andrews. Who is P. Andrews? May I ask? I would just want to get your name correctly for my record here so I can follow up. Are you there, P. Andrews? Penny Andrews, thank you. Congratulations, Penny. What I remember from the presentation was that attachment helps the baby learn how to be in relationship with the parent. So, but all the answers were correct for sure. So congratulations, Penny, yay. Okay, so here's another one. Oh, change my. Okay, so this is a 2-word answer. Perfect parenting blankety blank. And there's a couple answers I have in mind, but yes, it doesn't exist exactly. And I was also thinking fake news was another way that Mary described it. Doesn't exist, never exists, yes. Okay, so it looks like in my chat window, it is Annette Montgomery who wins our next coffee card. Congratulations, Annette. Awesome. Okay, one more. Okay. So in this final quiz question, it was we are encouraged as parents to try to be blank and blank in reacting to a child's behavior. Remember, there were 2 words. Responsive is good. These are all good. The hint I will give is that it was 2 words that started with P, the letter P. Does anybody remember? Present, patient, positive, and patient. Oh, everybody's so close. Close. Everybody's so close. And everybody's also correct. Let's see here. Present and patient. How I think I might the first person to give what is it? Protective. I think present and positive. Also close. I think I'm going to see, go here, and it was oh wait, oh, there's so many here. Karen said warm and responsive, which I think is a really great answer. Probably somebody now. Oh, okay. Mary Ann said predictable and positive. So I'm going to give a coffee card both to, is it Karen I said first? Karen said warm and responsive, and also to, oh, so many answers here. I'm having a hard time. And Mary Ann Marianne said predictable and positive. So that is awesome. I have to make sure I get your names here. Mary Ann, and then who else did I say? I said, it can be hard to track everything here. Karen S. All right. Thanks for thanks for playing, and congratulations to our coffee card winners. And again, a huge thank you to our presenter, Mary, for coming in and sharing of your experience and wisdom. And I'm going to stop recording now.